One of the first things that I would want to do is make sure we have an order to draw blood, of course, because every time you enter into that line, you put that patient at risk for sepsis or infection by drawing or opening that line up. Okay. Also, when we do the dressing dressing change, we're going to need a CVP dressing tray also. Okay. You'd want to make sure your surface is clean. You'd want to make sure your patient's not sitting on the bedside table like this one is. Same concept, because we're messing with or working with their chest. We'd want to have their head of the bed up with something supporting their back or having them lay down. Okay. So they would want to wear a mask because this under here is considered sterile, and you'd want to wear a mask also. So knock on the door, introduce yourself, have washed your hands with soap and water, put on clean gloves. Okay. So I've done that, have my clean gloves on. So I'm gonna start opening my flushes. We want to make sure that the air is out of the lines. Okay. One flush is for beforehand and one is for after we draw the blood. And we're just going to say that this patient's going to get something in their line afterwards, so we're not going to use heparin for this video or this return demo. Okay. So again, alcohol pad, and in your quick sheet and your thing, it talked about scrubbing that hub. You know, how long do we got to do that? 10 to 15 seconds, right? And so scrubbing that hub is so important. You're going to pick up your flush. Before you open your clamp, you're going to lock that syringe on. We're going to open it, pull back to look for blood return. I don't see any blood return. I wouldn't normally crawl into their chest and look for the blood, but I saw a little squirt there. Comes a little bit. Anyway, so make sure there's blood return before you flush it. You would flush with a whole 10 mLs of saline. Okay, for the sake of this video, I'm just gonna do 5, because we don't want to fill our thing up with just saline. That's probably what's happening. Okay, so flush it with 10, and then when your syringe is empty, then you're gonna go ahead and pull back and aspirate 5 mLs. Okay, you're gonna clamp your clamp. Okay, take that off. Okay, then you're gonna take your Vacutainer, put that on there like so. Open your thing again, and then you're gonna take our blue top one, because remember ProTime, like blood clotting and stuff, would go first. And I don't see that's gonna give us any blood, but we're gonna mimic that it does. Okay, so you would want to make sure that this tube fills primarily as much as it will fill for you. If your patient doesn't have any blood return or giving you any blood return, you can lay them back. You can turn them on their side also to see if that would help give you any better blood, okay, return. Then that would pop off. You want to invert this 5 to 10 times and set it where you're not going to lose it, or it's going to not drop off somewhere off the table. You're going to pop your next one on. Okay, that one would fill. Okay, let it fill to as high as it will go as well. You would pop it off, invert it 5 to 10 times, and the whole purpose is to keep it from clotting off. And then your purple or CBC one should always be last. And then again, you might have to reposition your patient depending on their positioning and how they're going to give you blood. And then sometimes these CVP lines, one side will clot off, and so it's really important to tell in report, like, hey, that red port on that CVP line's not working anymore, because you don't want to push a flush in and cause a clot or for it to break. And so they might tell you, oh, we got to use the blue one or the white one. Okay, so then this would come off, or close this for a minute. Take that off. Take this. Put it on there. And then we would want to flush our line again. Okay. And with this, after that, because they say that the person shouldn't get a whole lot of saline throughout the day if you read your quick sheet, because it can throw out their labs and cause other problems. And so just enough flush to get the line clear and hook up whatever you're hooking up next. Okay. But always, always, always a CVP line, a port, always have to have a 10 ml syringe, never a 5 or a 3 ml syringe because of the pressure in the line. Okay, so as you're finishing your flush, you're going to clamp your clamp. Okay, and then we would have a new alcohol cap to put on the end of that. Okay, then your 3 tubes that you have, pick them up. You would want to put labels from your patient's chart on these that have the patient's name, their room number, their birthday on here. Then you as the nurse are going to write your initials, the time and date that you drew this blood, and if it's a stat, write stat on there too. And so your writing is going to be really tiny and it has to be legible. Okay, that's the key, legible. And so then all your tubes would go in a biohazard bag. I don't have a biohazard bag, so here we go. We got the Ziploc. So this is our biohazard bag. They would all go in there. Also, when you are verifying or drawing blood, you always want to ask your patient, just like giving a med, you want to ask them what their name and date of birth is. And then again, when you are labeling all your tubes, you ask them again to help prevent errors from happening. Okay? Then if the lab person is up on the floor waiting for you to have drawn this, you would hand the bag off to them and they would take it to the lab. If you're responsible to get this to the lab, then you or a technician could take this to the lab. Okay? All right, so that's lab draw.